So hello everyone, let us discuss the next topic, that is the muscular system. Now muscular system, as the name suggests, we are going to talk about the muscles of the body. Okay, so let me show you how interesting this is. Actually this is the main bulk of the body. You can see this beautiful skeleton. Okay, so here let me just add this muscular system. So you can see there are so many muscles in the body, right? So which we will deal region wise when we will talk about the specific areas one by one, but right now we will just talk about the muscular system as a whole. Okay, as a part of general anatomy. So you can see there are so many muscles. You can see here the pectoralis major, the first muscle. So just on top of it you have the integumentary system. Obviously the connective tissue is also there. So if I just remove the integumentary, you can see the connective tissue, the fascia, all those things we have discussed in the last class. If I remove this, so now we can see the entire muscles. So you can see the one muscles like the biceps brachii, dole sholle, all these muscles I think you have heard somewhere or the other. In some movies also they mention. So you have some of the idea. Rectus abdominis, okay, with the rectus sheath. If I just remove this, you can see this rectus abdominis muscle, the six-pack abs which you have seen. Okay, so all these things, you can see the thigh, okay, thigh muscles. So there are so many muscles in the body which we will definitely discuss everything in so much detail that you will not forget anything. So let us dive in to the general anatomy part, that is the muscular system. So as for any topic we discuss, we always talk about the competency based undergraduate curriculum, right? So first and foremost, we need to understand the classification of the muscle tissue according to the structure and the action, right? Then we have enumerate the parts of skeletal muscle and to differentiate them between the tendons and the aponeurosis with some examples. Okay, we will also understand about the shunt and spurt muscles. Okay, so that is as per the competencies. So let us dive into this topic. So firstly, talking about the introduction. Okay, so the muscle is a contractile tissue. Okay, muscle is a contractile tissue. This thing we discussed in the last class, if you remember. The muscle tissue, it consists of the cells which are called, it has the cells which are called the myocytes, okay, or also known as the muscle fibers, basically simple. So the myocyte is elongated or spindle shaped cell. Okay, so this is a elongated or a spindle shaped cell. Okay, the size, shape, everything, characteristics will vary obviously depending on the type of muscle fibers. We will discuss that also. So you might be wondering, this word came from where? So this muscle word okay, this is derived from the word mus, and mus you all know that is the meaning is mouse in Latin. Okay, so it resembles a mouse. Just let me try to sketch it out. A mouse, ठीक है, suppose ये इसके पैर बना देते हैं. Okay, so just understand this part resembles the mouse, that is the spindle shaped cell or elongated. ठीक है, बहुत अच्छी ड्राइंग नहीं है माउस की, but you are getting an idea, I suppose. Okay, so this is the mus or the mouse, that is the muscle which we are using the word. Now in a muscle, we have certain things which you will hear. One, that is sarcolemma. Sarcolemma, this means the plasma membrane. Okay, then we have sarcoplasm. Any guesses? That means the cytoplasm. So, cytoplasm. Then we have the sarcoplasmic reticulum. Sarcoplasmic reticulum. This means the endoplasmic reticulum. You might have heard of this already in your biology classes also, right? Then we have the sarcosome. Sarcosome. The sarcosome means the mitochondria here. Okay, so the word which we are deriving, that is a sarcoplasm. Okay, so that is the sarcos means flesh. Okay, so you can break this word also, sarcoplasm. So sarcos sarcos means flesh. Okay, and plasma means a thing in Greek. Okay, so this is about the different nomenclature which is followed. Okay, so all the muscles are derived from mesoderm except few which are derived from ectoderm, such as the erector pylorus muscle, the muscles of the iris, the myoepithelial cells. Okay, so all these cells which you will gather information over the period of time. So overall, just remember this much for the beginning. So next we talk about the major functions of the muscular system. Okay, major functions. So what are these major functions? I think you might be able to guess them also. It's very easy. So if you just have the list in front of you, you will be able to answer in the Viva. That's the basic point. So movement of body, number one. Number two, the maintenance of posture. Okay, maintenance of body posture. There are a lot of postural muscles. Okay, then we have respiration. You remember the diaphragm being the primary muscle for respiration. Then we have production of body heat. Okay, production of body heat. Number 5, we have communication. Now communication can be in the form of speaking. So there will be the muscles of the larynx, okay, which will be for the articulation of the speech, right? Then for writing, you will be using the hand muscles like I am using right now. Okay, then the facial expressions. So those peniculus carnosus, okay, the muscles of facial expression which we discussed last time. So we will discuss that when we will talk about the head and neck and face. So that is the facial expression. You might be happy right now, you might be sad right now, irritated right now कि anatomy अभी शुरू ही हुई है, इतना कुछ है, can't help it. Welcome to MBBS. Number 6, and this is just the beginning. The things will get complex day by day. Okay, but I will try my level best to make it simpler and add a pinch of 3D wherever possible. Then contraction of organs as well as vessels. Okay, so like gallbladder, if you know it, contracts to release the bile. Okay, so that is also some kind of musculature which is helping it. Okay, similarly vessels are also contracting. Then you have number 7, that is the pumping of blood. Okay, So these are the primary actions, functions which you should be remembering. Okay. Then we talk about the next, that is the classification of muscles. Okay, now classification, please pay attention, it's very important Viva question. Okay, so there are two kind of classification. Okay, so number one we have, that is the structural classification. Structural classification. Okay, so structurally the muscle is classified based on the presence of striations in their cytoplasm. Okay, so this is based on the presence of striations in their cytoplasm. Okay, so what does this include? This includes number one, that is striated muscle. As the name says, striations के basis पे हम divide कर रहे हैं obviously. ठीक है, so striated muscle. Then we have B, that is the non-striated muscle. Simple classification. Okay, striated and non-striated muscle. ठीक है, so number one, striated. This includes any guesses? That is the skeletal muscle and the cardiac muscles. We will see the differences, don't worry, in a while. Okay, then we have the smooth muscles in this category, which are classically the non-striated muscles. Then we have number two classification, that is the functional classification. That is the functional classification. Now this functional, as you can imagine, this is based on the physiological control of the muscles. Okay, so this is based on physiological control. ठीक है, that is A category, that is voluntary muscles. ठीक है, voluntary muscles, and the other one would be involuntary muscles, and I think you might have been reading about this classification also. ठीक है, so इसमें क्या क्या आ जाएगा? There will be the skeletal muscles, which are also known as the striated muscles, also known as voluntary muscles. In case of involuntary, here is the twist. Involuntary muscle, we have the cardiac muscle and the smooth muscles, obviously. ठीक है, so this is something of great importance for Viva as well as understanding conceptually. Next, let us see this differences in the three muscle groups. So first we have the skeletal muscle here, cardiac muscle, the smooth muscle. Okay, so this is how it looks like on a a histological section. So let us see, this is just a schematic representation, so I'm going to make you understand what are the features. So have a look at one by one. First is the skeletal muscle. Okay, now skeletal muscle as you can see, it has the muscle fibers which you can appreciate. Classically, which is important feature is this one. The classic most important feature is the peripheral flat nucleus. Please remember this. Okay, then you have striations, which are dark and light bands. Okay, this is again very important. So these are the two classical features of the skeletal muscle which you cannot skip to miss. Okay. Then you have the cardiac muscle. Now cardiac muscle has certain features again which are super duper important. So number one and classical feature, that is the single oval centrally placed nucleus. ये कैसे? Just have a look. Just this, see, this is one cell. Okay, it has one nucleus which is oval. Okay, you can appreciate here also similarly. What else you can see? A very classical important feature is the branching of the cardiac muscle fibers. Apart from striations may or may not be seen sometimes on the microscope, but these are the classical features: the branching pattern, the nucleus being single centrally placed as compared to the peripheral flat nucleus. Then classical feature again, intercalated disc. This is also asked in MCQs. Intercalated disc is a feature of the classical feature of the cardiac muscle. Then obviously dark and light bands, which you can appreciate. I will tabulate the differences in a while, don't worry. Then you have the smooth muscles. So smooth muscle is fairly easy. Now smooth muscles have spindle shaped cells, classical ones, okay, and flat elongated nucleus, just like the case of skeletal muscle. But what is the difference here? Can anyone appreciate? Here we do not have something like the peripherally located flat nucleus. ऐसा नहीं है. It is a centrally placed nucleus, but it is flat. Okay, so that is flat elongated nucleus, but in the center of the cell, because cell itself is a spindle shaped cell. Okay, so you can appreciate this is the kind of shape. Can you appreciate one more thing? This section shows the fibers differently as compared to this section. Why so? Because this upper one is the longitudinal section and below one is a transverse section. So if a muscle fiber is running in this way, so if you cut it transversely, how it will look like, and longitudinally along the plane, how it will look like, that is the point shown here. And you can be asked and tested upon any kind of section. Okay, LS or TS, anyone. So I hope this is clear to you, the skeletal, smooth and cardiac overview. Just take understanding के लिए how to remember them. ठीक है. So another thing about this is regarding the intercalated disc. Okay, so you should be able to write this and note this down. This intercalated disc is a very special feature of the cardiac muscle. Okay, and it has a very famous MCQ linked to it, that it has what are the subcomponents of intercalated disc. Although in histology we will be covering, but here I am mentioning it so that you are quite clear about this. And the important things, if they are repeated, it stays in your mind for a longer run. So intercalated disc has three junctional complexes. One is the fascia adherens. Okay, then you have number two, that is the desmosomes, and then we have the gap junctions. Okay, and also another point to remember, this cardiac muscle, this acts as a functional syncytium. Okay, functional syncytium. So taking off the important words here, the functional syncytium, the F from fascia adherens, desmosomes का D and junctions का J. So you can remember this by a very famous or easy mnemonic, that is the cardiac muscle has a functional DJ. ठीक है. So you can remember this with the help of a mnemonic, functional DJ. ठीक है. So that means that the cardiac muscle has a functional syncytium and it has a integrated disc which has the fascia adherens, desmosomes and gap junctions. So that way you can remember the functional DJ mnemonic to easily recollect. Okay. Then talking about the differences in a tabulated manner, because this is the way how you will be able to write in the exam. So number one, you have the skeletal muscle, then you have this cardiac muscle and smooth muscle. So I will be highlighting and underlining the most important differences which you cannot afford to miss. The rest you can or may not remember. Okay. So muscle fiber, it is unbranched and cylindrical in case of skeletal muscle. Cardiac muscle, it is branched cylindrical. Okay. In case of smooth, it is unbranched spindle shaped cells. Okay. Spindle shaped is the classical word which is to be remembered. Okay. And branched, remember, for the cardiac muscle. Okay. This is one thing again. Then multinucleated, peripherally placed flat nucleus. Cardiac muscle, single nucleus, centrally placed, oval shaped. Single nucleus, centrally placed, same for cardiac as of smooth as we saw, but elongated in such a case. That is the classical difference between the two. Okay, the oval shaped, here we are saying oval and here we are saying elongated. So that is the difference. Then you have the striations present, but it is absent here, and classically the cross striations are seen in the skeletal muscle. Okay. So in cardiac you may or may not be able to appreciate, as I told you previously also. Okay. Then cell junctions, as I told you, the junctional complexes are present in the intercalated disc, we have already covered. Gap junctions are present in smooth muscle and no cell junctions are present in skeletal muscle, but it has separate things which we will discuss in a while in detail. Then voluntary, involuntary we know. Okay. Then mitosis, regeneration, rhythmicity is important. Skeletal muscle, it is absent, it is present and present for the other ones. Okay. Then stretch receptors are present in case of skeletal, absent for the other two. Then very important, which is asked in the exams also, the classical examples for all the three types. Okay. So the skeletal muscle itself, that is the tongue, esophagus, diaphragm, we have loads and loads of skeletal muscles in the body, you can name any. Okay. The classical question comes here. Cardiac muscle, heart you will always remember. Okay, that's not a difficult thing to answer, but the another answer is superior and inferior vena cavas, even the pulmonary veins, they have the cardiac muscle. Okay, muscle fibers are there. And then smooth muscles, again the vessels, the tubular viscera and the various organs, so they have the smooth muscles. So these are the classical things which you should be able to remember from this topic. Then we come on to the basic properties of the muscles. The basic properties of muscles. Okay. So the basic properties of muscles, there are 4 basic properties as such. So what are those? Number 1, that is the contractility. Okay. So that is the ability to shorten with the force. Ability to shorten with force. Number 2, we have the excitability. Excitability means the capacity to respond to the stimuli, okay, which this stimuli can be chemical stimuli or a neural, or you can say neuronal stimuli. Number 3, we have extensibility. Okay, so the capacity again to regain the normal shape, on removal of the stimulus. Okay. Number 4, we have the elasticity. Okay, now elasticity is the capacity again to assume a desired shape, regardless of the stretch. Okay, so this is one, contractility. Then you have excitability, then we have extensibility, and then we have elasticity. Okay, so there shouldn't be any confusion. This is just purely conceptual understanding. Okay, then we have the next one, that is the skeletal muscles itself. So before you come to this image, let us understand few more things. Thus about the skeletal muscles. Now these are the most abundant muscle in the human body, as you know, right? They are also known as striated or voluntary muscles, or also known as somatic muscles. Now there are certain parts of a skeletal muscle, okay, so which you should be understanding. Now typical skeletal muscle has two ends, one will be the origin and insertion, okay, two parts, the fleshy and the fibrous. Okay, so let us understand the parts of the skeletal muscle. Okay, number 1, it has two ends. I will show you in 3D also, you will get a better understanding. Two ends, that is the origin and insertion. Okay, you will be actually irritated from this word origin and insertion, because all the muscles, majority of them will be tested in your exams, which is the origin, which is the insertion of that muscle. Okay, in osteo viva, in soft part viva, that is one thing which you can't avoid, and especially the important muscles. Not all the muscles, it's not humanly possible to remember them, but yes, the most important ones, and we will discuss them properly, and in 3D you will definitely be able to remember. Then we have number 2, that is the two parts. Okay, so what are these two parts? That is the fleshy part and the fibrous part. Okay, fleshy and the fibrous part. So these two ends, the origin and insertion. So origin means the end of the muscle that remains fixed during contraction. Okay, so just write this, let me just, okay, so origin typically means the end of the muscle that remains fixed during the contraction. Okay, whereas insertion this means the end which moves during the contraction. End which moves during the contraction. Okay, so that is the classical thing, which is an age old thing which you might be hearing from everyone, but I am adding another thing which you should be able to remember. Now, as per the latest Gray's edition, 42nd edition, and as per the latest terminologies which are used, the terminology of origin insertion has become obsolete. Okay, so although textbooks do mention this will never go away, but you should be knowing now we use the terms proximal and distal attachment. Okay, so this is something which is recently started using, so you should be knowing about this also. Okay, so you can see, for example, any muscle, let us take classical muscle, let's take biceps brachia, isolate this. Okay, you can see this muscle is attached at two ends. Okay, can you appreciate this, right? So you can see this is attached at two ends, one at the scapula bone, if you are aware of the bones. Okay, you might have done the basic medical anatomy and physiology course, so you should be able to recollect the names of the bones at least. Okay, so this is the scapula which you can see here, and then you have the bone which you can appreciate, this is the radius. Okay, so and then on the side, other side, you can see the ulna. Okay, so you can see this muscle is being attached at two ends. So one of the attachment is a origin. If I show you in the motion, let us see the classical one, elbow flexion. Okay, so now have a look, you will get a better orientation. So this is how you will be going to study all the muscles. Okay, so no rote learning, nothing, just see, visualize, remember. Okay, so in this case of biceps brachii, the muscle has an origin which is on the top towards the scapula, and so you can see another part which is attached below, distal, that is distal attachment. I hope you understand. Proximal is close to the body, distal is away. Okay, distal is moving away, farther away. So distal attachment, so अगर ये muscle है, so you can see video right now, जो ये muscle है इसकी distal attachment will be this one towards the elbow joint. Okay, and this will be towards the shoulder, this will be the proximal part. Okay, so we have a proximal attachment which is the origin, and then we have the insertion, or you can say distal attachment in this case. So this is true for all the muscles. Okay, so you can see this very clearly in 3D also, how this elbow flexion is happening and how this muscle is contracting. Okay, so we come back. So you have understood the two ends, the origin and insertion. Next we come on to the two parts, that is the fleshy part and the fibrous part. Okay, so let us understand what are these two parts. See this photo, we have already discussed this. Origin, second, so we have already discussed this origin, okay, and insertion, okay. Next we come on to the two parts, that is the fleshy part. Okay, okay, fleshy part, and then we have the fibrous part. Okay, so let us understand these things. So the origin and insertion we have understood. Now talking about the fleshy part. Okay, so this fleshy part is the contractile portion and it is known as the belly. Okay, please note this. This is the contractile portion and this is known as belly. Okay, whereas we have this fibrous part which is the non-contractile part. Okay, non-contractile and I can say inelastic part. Inelastic part. Okay, so this inelastic part or non-contractile part, this part further can be in the form of a tendon and aponeurosis. So now what are these two terms? Let us understand. We have a term that is tendon. Tendon simply means a cord or a rope like fibrous part. Cord or a rope like fibrous part. Whereas we have aponeurosis, and we discussed previously also, if you remember, aponeurosis. Now aponeurosis simply means a flat fibrous sheath, a flattened fibrous sheet. Okay, so this is something which you should be able to differentiate. And now you will also be able to hear another word, that is the raphe. Okay, so what is this raphe? Let us understand this also, a terminology that is raphe. Okay, so raphe का मतलब क्या है? Let us understand. Raphe is a linear fibrous band. It's a linear fibrous band which is formed by the interdigitation. I will show you in 3D also. Interdigitation of the muscle fibers. Okay, and this, as you can understand, this is stretchable. Okay, so that's a raphe. Let us note down the different examples of raphe in the body. Examples. So one example, that is linea alba. You will hear this name in the abdomen and pelvis. Then you have pterygomandibular raphe. Pterygomandibular raphe. Okay. Then you have mylohyoid raphe. Okay, mylohyoid raphe. Then we have the pharyngeal raphe. Okay. Then we have the anococcygeal raphe. Anococcygeal raphe. Okay, out of this you can see this is the mylohyoid raphe in the center. Okay, here you can see क्या हो रहा है basically, the muscle fibers, they are going towards the midline on both sides. ठीक है, and they are interdigitating इस तरीके से. ठीक है, so that is forming a midline structure, that is a raphe. Okay, let me see if I can show you on 3D. ठीक है, इसमें ये हटा देते हैं प्लेटिस्मा. Okay, now you can see the same thing in 3-dimensional view. This is the mylohyoid muscle. Okay, so if I just try to isolate this, and maybe you can appreciate, see how it is, how the fibers are interdigitating हो रही है. ठीक है, interdigitation of the muscle fibers, and in between the center you can see a white line in here just showing, depicting the raphe. Okay, so this is something which you will get to hear multiple times at various places in the body. So wherever we hear, we will talk about that. So these are few examples of raphe, okay, which you should be able to recollect. Then we come on to the clinical integration. Clinical integration is very important in this area because of the muscular system, and this is the bread and butter of your practice if you are doing. So this will be, that is the intramuscular injection. So most common sites of intramuscular injections. ठीक है, so these are certain most common sites which are used for the intramuscular injections. So what are these? Number one, that is the deltoid muscle का middle part. Then number two, you have the that is the upper and outer quadrant of the gluteal region. Number three, you have the anterolateral aspect of the middle part of thigh. So this is something which I have written in the sequence of how it is frequently used. Okay, most common सबसे पहले, और थोड़ा सा like uncommon, or depending upon the medicine which you are injecting and age group also. ठीक है, so this is the deltoid muscle on the side. Okay, so you can utilize this. The see, what we are doing is the fleshy part of the skeletal muscle is the one which is we are utilizing for the IM injection. ठीक है, so there are many drugs available, many you have the medications which are available, vaccinations which are available, okay, which you inject intramuscular. Okay, so अच्छा इंट्रा बोल रहे हैं मतलब कि इनसाइड द मसल. ओके, इट्स नॉट इंटरमस्कुलर, नहीं है, बिटवीन द टू मसल्स नहीं है, इट इज इंट्रा मीन्स अंदर, एक ही मसल के अंदर हम जा रहे हैं. सो वी आर यूटिलाइजिंग द मिडल पार्ट ऑफ डेल्टॉइड. हेयर इफ यू सी द ग्लूटियल रीजन, द बटॉक्स. here see another thing to remember, right now I am only telling you the main technique of an IM injection involves the avoidance of injury to the nerve in that area. Okay, so for example deltoid muscle, so we need to prevent the injury to the axillary nerve. Okay, so that is classically important, that is close to the surgical neck of the humerus, which we will study in detail eventually. So you need to be a good technician in this, you have to apply a good technique to go and prevent this injury. Here the nerve which you can classically injure is a sciatic nerve. Okay, the thickest nerve of the body. Here that is why we go for the upper and outer quadrant. In this case we have muscle fibers which are utilized classically in the children. Okay, when you can inject the medicine on the anterolateral aspect of the middle part of the thigh. That also we will discuss regarding the vastus lateralis. Okay, here the muscle which is injected in, which is used is the gluteus medius muscle. Okay, so that is the undercover, the gluteus maximus. You can see this, it is quite visible. This is the deltoid muscle, okay, on the side, which we are utilizing for the IM injection. Then we can use this muscle on the buttocks, outer upper quadrant. This is the gluteus medius muscle which is used for the IM injections. Then quickly you can see on the thigh region, you can see this is the muscle which is used, this is the vastus lateralis muscle. Okay, so these are the classical things which you should be able to remember. Okay. So then we come on to the microscopic structure of the skeletal muscle. Okay, so here the microscopic structure of the skeletal muscle. So skeletal muscle actually consists of two things, okay, to be very clear and honest. There is number one muscle fiber and the second is the supporting tissue. Okay, so you can write this. The muscle, skeletal muscle consists of number one the muscle fiber, number two the supporting tissue. ठीक है. So supporting tissue of the skeletal muscle, that includes these three structures which are written below. Okay, so that is the epimysium, perimysium and endomysium. So what are these? Let us see. Have a look. ये bone के ऊपर tendon दिख रहा है attachment, and this is the fleshy part, the muscle is attached. So if you take a cut section on this, you can appreciate एक अंदर बिल्कुल सेंटर में दिल मसल फाइबर. ठीक है, उसके भी अंदर चले जाओगे, यू विल गेट अ मायोफाइब्रिल. उसका भी अल्ट्रा स्ट्रक्चर इज दिस वेयर यू विल डिस्कस इन अ वाइल. ठीक है, जेड बैंड, आई बैंड, एच बैंड, ये सब हम डिस्कस करेंगे. एंड देन यू हैव this muscle fascicle which contains so many muscle fibers, and then you can see this entire bundle which is containing a muscle multiple muscle fascicles. Okay, so what is this endomysium? So for सबसे पहले we have the endomysium, which is a layer of the reticular fibers that covers the individual muscle fibers. ठीक है, so muscle fiber ये वाला है and that is being covered by the endomysium. ठीक है, then we have outer to it is the perimysium. Perimysium is, you can see it is labeled here, this is the perimysium. ठीक है, perimysium is the one which covers a bundle or I can say a fascicle of muscle fibers. ठीक है, so that is the perimysium. ठीक है, perimeter जैसे यूज होता है वर्ड, perimeter kind of thing. Then you have even outer to it, that is the epimysium. ठीक है, epi भी सबसे बाहर है. ठीक है, so epimysium is which covers the entire muscle. Okay, so it's written epimysium is the one which entire skeletal muscle is covered by the epimysium. So these three mysiums should be very clear to you. They are very frequently asked in the MCQ and the Viva questions. Okay, right. So supporting tissue, it becomes continuous with a tendon at the junction of the muscle and the belly. Okay, as you can see in this image. And blood vessels and nerve fibers, they are present in all the layers of connective tissue. Okay, so if suppose if there is any external force, okay, so if there is any external force, the insertion end of the muscle is fixed, then the origin end of the muscle will move during the muscle contraction. So that is something very different out of the box. That is known as the reversal of muscle action. Okay, so there is a recent concept to it that some authors use the proximal and distal attachments instead of origin and insertion. As I told you, in the limbs origin is proximal attachment whereas insertion is distal attachment, as we discussed. ठीक है, ये हमने लिखिए था. Okay, so this is origin is the proximal attachment and insertion is the distal attachment. ठीक है, right. So talking about the microscopic structure of the skeletal muscle in much more detail. So we have the muscle fibers, okay, which are very important to understand. So let us write this. The microscopic structure of skeletal muscle. ठीक है, so number one, that is the muscle fibers. Okay, now muscle fibers, they are the contractile parts of the skeletal muscle. contractile parts of the skeletal muscle. ठीक है. Now each muscle fiber, that is the muscle cell or the myocyte which I am telling, okay, this is very long, okay, and then there is a concept which is known as the multinucleated syncytium, sorry, syncytium, ठीक है, multinucleated syncytium. Now what is this? Each muscle fiber is cylindrical, as we saw in a skeletal muscle, and it has multiple oval flat nuclei located at the periphery of the fiber, just beneath the plasma membrane. So that is why we are labeling it as the multinucleated syncytium, okay. And if we talk about the sarcoplasm, sarcoplasm we are referring to as a cytoplasm only. It shows transverse striations. It shows transverse striations of alternate dark and light bands, alternate dark and light bands, okay, due to the longitudinally oriented myofibrils, okay. Now this consists of bundles of myofilaments, and they are of two types, okay. So let us see the image to understand better. So have a look at this photo, okay. So we have bundles of myofilaments, as you can see in these images. So there are two types, okay. So let me write here only. Two types of myofilaments. Okay, what are these? Number one, we have the thick or the myosin filaments. Thick or the myosin filaments. And number two, we have the thin or the actin filaments, okay. The arrangement of these myofilaments, okay, this gives the striated appearance to the muscle fiber, okay. So this is the one which is causing the striations, okay. So in a polarized light microscope, let us note this down. In a polarized light microscope, okay, the muscle fibers, they will show, the muscle fibers, they show two things, okay. So number one, that is the dark or the anisotropic band, the dark or the anisotropic band, okay. This is the A band. And number two, we have the light, or I can say the isotropic band. And this will be known as the I band. पहले समझ लेते हैं क्या चीज़ें हैं, then you will see in the photo, it will very easy, ठीक है. सो इसको पहले याद रखें, that is very difficult. याद नहीं रहता कि कौन सा वाला कौन सा है. सो डार्क में A आ रहा है, ठीक है, कलर दूसरा लेते हैं. डार्क में वी हैव A and anisotropic में we have A, that is the A band, ठीक है. and light में we have I and we have isotropic I and I band, ठीक है. सो ये न्यूमोनिक है, याद रखने के लिए easy, ठीक है. So in the center of the light band, so you just see this image now. So we are saying that this is an A band, this region is showing the A band, and then we have the I band. Similarly we have again the I band. ठीक है, so A band, I band, A band, I band, इस तरीके से we have the things which are visible here, and you can see certain filaments are very thin and certain are thick. ठीक है, so thick वाले हैं that is myosin and thin actin है. ठीक है, so इतना हमें क्लियर हो गया. सो नाउ इन द सेंटर ऑफ द आई, ठीक है, ये आई बैंड के बिल्कुल सेंटर में, मिड लाइन में, इसमें इफ़ यू सी देयर इज़ द बैंड विद द लाइन दैट इज़ द जेड लाइन. ओके, सो हेयर यू हैव अ जेड लाइन और द जेड डिस्क. ठीक है, सो दिस इज इम्पॉर्टेंट अगेन. So we have okay, एक second, right. So we have the in the center, in the center of I band, ठीक है, in the center of I band we have a dark Z line, a dark Z line, or I can say Z disc is present. ठीक है, so this is another thing to remember. Z line हो गई हमारे पास, which is a Z disc दूसरे वर्ड्स में. ठीक है, okay. So now let us understand this. So Z is the Schweizens VV line, okay, which you may or may not remember. ठीक है, बहुत ही बड़ा नाम है. The in the center of the I band we have the Z disc or the Z line. ठीक है, ये हमें समझ में आया. Now what happens then, there is something in the center of the dark A band. अब A band है, उसके भी सेंटर में एक लाइन है. This is a narrow lighter zone which is known as the H band. Okay, so just see in this photo, in this here we have the H zone, or I can say the H band. ठीक है, so in the center of the A band, let us write this. In the center of A band, ठीक है, we have a narrow lighter zone, ठीक है, which is known as the called H band. Okay, yeah, I can say H zone, and we have a central dense M line. ठीक है, and central dense M line is present. ठीक है, so हमारे पास we have an H band and a M line. ठीक है, which is present here. Okay, right. So I'm trying to put everything on one slide so that it makes easy to revise. ठीक है, so I'm just revising this. So we have this I band, we have this A band. Number one story. Number second story, we have thin actin and thick myosin. Number two story. Number three story is that in the center of I we have the Z disc or the Z line. ठीक है, number four story is that in the center of A band we have the H zone or the H band, and in the center of H band we have a central line, dense line, that is the M line. ठीक है, so and another word, there is another word left, that is this one, sarcomere. ठीक है, so what is this sarcomere? we have something that is known as sarcomere. ठीक है. So this is the structure and function unit of myofibril. It is a structural and functional unit of myofibril. ठीक है. Now this sarcomere, as you can see, it lies between the two adjacent Z line. Okay, it is present between the two Z lines. Okay, I have crossed the line. ठीक है, it is Z line. Okay, and this is approximated 2 to 3 micrometers. Okay, so anyways, don't remember the dimensions, that is it. So this is the entire story of this microstructure of the skeletal muscle, which you can see here. And now how the contraction is happening, what is moving here, that is all about physiology. Okay, so this is just a part of anatomy, what all structure is there, and the functional part you will understand better in the physiology. Okay, so I'm not going to detail that part here. I hope it is clear to you everything. Then we come on to the clinical integration of this, or I can say interesting facts about this. Now that is the rigor mortis. ठीक है, this is something which you will study in the forensic department in detail. ठीक है, but yes, you will be seeing the cadavers, so you should be knowing what is rigor mortis. The examiner can ask you initially in the first year itself. Now rigor mortis, it is basically the stiffening. Okay, this is basically the stiffening of the muscles of the body. ठीक है, after death. That's the basic understanding about rigor mortis. Now important thing clinically is it starts around 2 to 4 hours. It starts 2 to 4 hours after death. ठीक है, and lasts for about 2 to 4 days. ठीक है, and then it gradually disappears. ठीक है, so this very important information can help us to understand the time after death also. Okay, sometimes criminal what they do, they the dead body is found somewhere by the police after some hours, so they have to estimate, the forensic expert has to estimate that when was the murder done. Okay, like how many hours back, so that is a very important medico legal importance. So what is the explanation behind this rigor mortis? So for the muscle relaxation, the bond between this actin and myosin, it should be released. Okay, for the muscle relaxation, which requires ATP molecules. But after death there is depletion of ATP, right? And the muscles, they remain in the contracted state. So the ATPs are also required to pump out the calcium ions from the muscle fibers, and lack of the ATP, it results in gradual accumulation of this calcium in the muscle, that leads to muscle contraction. Okay, and hence after 2 days the cellular enzymes and the natural decomposition, it breaks down the muscle proteins and it causes the release of the rigor mortis. Okay, so that is something which you will read more in detail eventually in the other profs and obviously in the physiology also. But let us talk about this rigor mortis we have understood. Now let us understand another concept, that is the types of skeletal muscle fibers. Types of skeletal muscle fibers. ठीक है, so what are these types? So based on the diameter and the color, ठीक है, this is based on the diameter and color. We are classifying this into two groups. Okay, number one group, that is the that is type 1, or I can say red fibers. ठीक है, type 1 or I can say red fibers. So now these are also known as the slow twitch or slow oxidative fibers. These are the slow twitch or slow oxidative fibers. ठीक है, so they are the one which will contract slowly. I will tabulate the differences in a while, but right now I'm just telling you the most important differences in one go. Okay, so they contract slowly, okay, but their contractions, they are more sustained as compared to the second type. ठीक है, and they are also resistant to fatigue. So now you should be able to guess which are these muscles in the body जो contract भी होती हैं and they are very resistant, fatigue नहीं होता इनमें बहुत जल्दी. ठीक है, so classical examples include postural muscles, हमारा posture जो maintain करती है muscles contracted state में रहती हैं. ठीक है, postural muscles, and also the muscles of the limbs. ठीक है, then we have the second category, that is the type 2b or the white fibers. Type 2b, ठीक है, we have the type 2b. ठीक है, type 2b are also known as white fibers. Okay, type 2b also known as white fibers. So these are the thick fibers or the fast glycolytic fibers. These are the thick fibers, or I can say fast glycolytic fibers. ठीक है, they are high twitch fibers. They are high twitch fibers which can generate more force of contraction. Generate more force of contraction. ठीक है, so they are mostly generating energy from the anaerobic glycolysis. They generate energy from anaerobic glycolysis and they fatigue easily. Any guesses about the muscles? Sorry. And they fatigue easily. ठीक है. So for example, the muscles of the eyeball or the and the muscles of the fingers. Muscles of the eyeball, muscles of the fingers, okay. So they are the one which fatigue easily. So while writing you get tired very easily, while studying you get tired very easily, ठीक है. So पढ़ाई लिखाई नहीं कर सकते, बाकी सब कुछ कर सकते हैं, okay. So these are the two main types of skeletal muscle fibers. You also have a third variety, that is a type 2A, that is the intermediate fibers, ठीक है. Those are the medium sized fibers, although no one is going to ask you about them, so don't bother to remember them, ठीक है. So just see the difference between these two main types. Again in this table we will mark the most important differences. ठीक है. So type 1 slow oxidative fibers, type 2B or fast glycolytic fibers, classically important, ठीक है. Then the other thing is the myoglobin quantity, it is more, that is why it is red also, okay, more red fibers, and this is myoglobin quantity is less. Mitochondria is more in this, okay. Then this is mode of contraction, slow twitch, fast twitch, okay. So these are all important differences. Resistant to fatigue, easily fatigued, okay. Oxidative phosphorylation, and here you have anaerobic glycolysis. Glycogen content is less, it is more in white fibers, ठीक है. Classical examples याद रखने हैं. Postural and limb muscles, ठीक है. Here you have precise rapid muscles like muscles of eyeball, muscles of fingers. Then you have blood supply which is rich and poor, then nerve supply. So this is the one which is much more important differences as you can fetch. And another thing, just for a clinical orientation, you should be knowing the red fibers, okay. The red fibers, they are the ones which are useful for long distance running, for long distance running, ठीक है. Whereas compare this with the white fibers, this white fibers are the one which are useful for rapid and skillful movements, ठीक है. Rapid and skillful movements, okay. So you can just guess for this muscle examples also, like the limb muscles was in this example, so they are used for long distance running. Then muscles of eyeball, fingers, fine movements, rapid, very fast and skillful movements are done by this, okay. Then exercise improves the aerobic metabolism of the red fibers, okay. That is also an important thing which you should be knowing. Then we come on to a very interesting area of muscular system, that is the fascicular architecture, okay. Now the muscles, they have a variety of fascicular arrangements, okay. So what are those? As you can see in the photos, it's very well evident. First one, that is the parallel muscle, okay. Then you have the convergent muscle, we have the spiral or the twisted muscle, okay. So we have also the cruciate muscles, the sphincteric muscles, the pennate muscle group, okay. So let us talk about them one by one. The parallel muscles first. ठीक है. So parallel muscles, these are the muscle fasciculi are arranged parallel to the line of the muscle pull, okay. So the arrangement provides a maximum range of movement, okay. So this helps in the maximum range of movement, ठीक है. So they have a very small number of fibers, hence they produce less force of contraction, okay. They have less or I can say smaller number of fibers, ठीक है. Therefore they have less force of contraction, ठीक है. So the parallel fasciculi, they can have arrangement like quadrilateral muscle. ठीक है. So quadrilateral muscle example, thyrohyoid, pronator quadratus. You will hear these names eventually in the whole year. Okay. So if you want, I can write them. You will have a comprehensive thing. I'm just writing any one or two examples of each of them, so that will be more than sufficient. Okay. So quadrilateral like the thyrohyoid, pronator quadratus, pronator quadratus. ठीक है. Then you have the strap like tendinous insertions like the rectus abdominis, as we saw previously also in 3D. Rectus, the strap like, the rectus abdominis. ठीक है. सॉरी, स्ट्रैप लाइक में एक्चुअली दो वैरायटी है, स्ट्रैप लाइक विथ टेंडिनस इंसर्शंस इंटरसेक्शंस एंड वन सिंपल स्ट्रैप लाइक. ठीक है. सो टेंडिनस इंटरसेक्शंस में वी हैव द रेक्टस एब्डोमिनस. ओके, सो दैट इज ऑल्सो एन एग्जाम्पल. मैं एक काम करता हूँ, जस्ट होल्ड ऑन, इट विल बी मच बेटर इफ आई राइट इट ऑन द साइड्स, यू विल बी एबल टू रिकलेक्ट. ठीक है. सो क्वाड्रिलेटरल, इसमें वी हैव द thyrohyoid, pronator quadratus. ठीक है. Then we have the strap like. Okay, this is the rectus abdominis with intersections. ठीक है, with tendinous intersections. Okay. Then we have fusiform. Fusiform, they are a classical example which we saw in 3D, that was biceps brachii. ठीक है. Digastric muscle, the loads of examples. ठीक है. Then you have convergent muscle. The muscle fasciculars, they converge at the insertion point. So these are very powerful muscles with a limited range of movement. Okay, so that is like example triangular muscle. Here you can remember adductor longus, adductor longus. ठीक है. Then fan shaped like temporalis, temporalis. ठीक है. And then we have the spiral or the twisted muscle fibers. So this is the muscle fiber fasciculi, they have twisted arrangement near the muscle insertion. With such arrangements, actually they help to change the direction of pull. Okay, so the classical example, that is the pectoralis major. We will deal with this in the upper limb. Pectoralis major. And then you have trapezius. ठीक है. Latissimus dorsi, the supinator muscle. Okay, the first example is the most important one. ठीक है. Then we come on to the cruciate muscle fibers. As you can say, crisscross pattern बन गया. So the muscle fibers are arranged in the strata which cross each other in the form of X. ठीक है. So classical examples, the sternocleidomastoid muscle. ठीक है. The masseter muscle. Don't worry upon these, you will read them in detail. Okay. Then adductor magnus muscle. ठीक है. Then we have sphincteric action. Now sphincteric action, these are arranged around the opening or the orifice. So their contraction actually closes the opening. So you can imagine examples, the example being the orbicularis oculi, orbicularis oculi, around the palpebral fissure of the eye. Okay, around the palpebral fissure. Then you have orbicularis oris, around the mouth, around the oral orifice, that is the mouth. ठीक है, ये around the eye है ऊपर वाली, this is around the eye, this is around the mouth. ठीक है. Then you have the muscle, that is the pennate muscles. Now pennate muscles are the most important ones from Viva point of view. ठीक है, pennate, they are arranged in an oblique manner to the line of muscle pull. The arrangement resembles like a feather. ऐसा नहीं लग रहा है जैसे पंख की तरह. ठीक है, resembles like a feather if you can see. ठीक है, so now see, that is the reason they are called as pennate muscles. ठीक है, so it has greater force of contraction. They resemble feather. ठीक है, and they have great force of contraction, greater force of contraction. So now this has further subtypes. Number one is the unipinnate one. ठीक है, first one is the unipinnate. You have unipinnate, bipinnate, multipinnate and circumpinnate. ठीक है, unipinnate. So all the fibers, they are sloping. I am writing here only. I hope you can see. Yes, unipinnate. So इसको थोड़ा zoom out कर लेते हैं. Just wait. So unipinnate muscles, they are the ones which slope inside, which slope into the side of the tendon along the line. Okay, so it gives one half of a feather appearance, as you can see in this photo. ठीक है, so examples, example extensor digitorum longus, extensor digitorum longus. Okay, then flexor pollicis longus. ठीक है, and then peroneus, अरे यार, just wait, we have extensor digitorum longus. ठीक है, then we have flexor pollicis longus, and then we have peroneus tertius. ठीक है, ये सारी मसल्स यू विल हियर इवेंचुअली इन द ड्यू कोर्स ऑफ टाइम, डोंट वरी. बाइपिनेट का एग्जांपल, टेंडन इज फॉर्म्ड इन द सेंट्रल एक्सिस, द मसल फाइबर्स आर स्लोपिंग इनटू टू साइड्स ऑफ द सेंट्रल टेंडन. ठीक है, सो इट गिव्स अ फेदर लाइक, एक्चुअल फेदर लाइक अपीयरेंस. वो पहला हाफ फेदर था, ये फुल फेदर लाइक अपीयरेंस है. ठीक है, सो क्लासिकल एग्जांपल रेक्टस फिमोरिस, रेक्टस femoris. ठीक है, and then you have the flexor hallucis longus. ठीक है, then dorsal introitus, dorsal introitus of hand and foot. ठीक है, then we have multipinnate, which have a series of bipinnate arrangements, as you can see. So it has multiple septa that give origin to another set of septa that give insertion. ठीक है, as you can see in this photo. So classical example इसका जो वाइवा में पूछा जाता है, that is the deltoid muscle, जिसमें हम IM इंजेक्शन दे रहे थे. ठीक है, then you have the circumpennate. So it has a central tendon, और उस fibers are converging from all the directions in a circular manner. ठीक है, from the tendon. So इसका classical example, that is a tibialis anterior muscle, tibialis anterior. ठीक है, सारी muscles we will read in eventually. ठीक है, don't worry at all. 3D में भी देखेंगे region wise. ठीक है, so ये examples हैं, don't confuse them, they are written together. Okay. So we have understood the fascicular architecture with respect to the different fibers, arrangements of the fibers. Okay, then we come on to the very interesting part, that is the nomenclature of the muscles. ठीक है, अब nomenclature of the muscles में let us understand the names, and that is very easy and important again. So the muscles, they are named according to this nomenclature is according to the location, ठीक है, location, shape, action, okay, number of heads, okay, then attachments, direction of fibers, ठीक है, size of muscle, ठीक है, and the list is actually further, but this is much more sufficient for you. So we'll talk about them one by one. So number one, that is the location. ठीक है, so based on the location we have anterior, like tibialis anterior, tibialis posterior, ठीक है, tibialis, एक दो एग्जाम्पल्स याद रख लेंगे सबका, ठीक है, tibialis anterior, tibialis posterior. Then we have lateral, similarly we have medial, lateral हो जाएगी vastus, lateralis जिसमें हम IM इंजेक्शन लगा रहे थे, फिर रिमेंबर, देन vastus, medialis, ये सबसे इजी वाले नाम है, इजी एग्जाम्पल्स टू रिमेंबर, ठीक है. देन यू हैव सुपीरियर, वी हैव इंफीरियर, सुपीरियर में आ जाएगा सुपीरियर रेक्टस, ओके, सुप्रा स्पाइनेटस, ओके, देन वी हैव इंफीरियर रेक्टस, दीज आर रेक्टस आर द मसल्स इन द आई बॉल, ठीक है. देन वी हैव इंफ्रा स्पाइनेटस, ठीक है, सबसे आसान नाम है बेसिकली ये, ठीक है, इतने आसान है नहीं बाकी पूरी बॉडी में, बट ठीक है, ये सबसे आसान वाले हैं. देन देन वी हैव द सेकेंड वन, दैट इज द रीजन, ठीक है, रीजन. नाउ रीजन में बैक, और आई कैन से डॉर्सल साइड, ठीक है, दैट इज एग्जाम्पल लैटिसिमस डॉर्साई, ओके. देन वी हैव पेक्टोरल रीजन, पेक्टोरल रीजन में पेक्टोरलिस मेजर, ठीक है. देन वी हैव टेम्पोरल फोसा, टेम्पोरल फोसा, टेम्पोरालिस मसल, ठीक है. देन इन बिटवीन द रिब्स, दैट वुड बी द नेम इंटरकॉस्टल मसल्स, ठीक है. ग्लूटियल रीजन, वी सॉ द नेम्स, ग्लूटियल रीजन में मसल्स हो गई जैसे कि ग्लूटियस मैक्सिमस, मीडियस मिनिमस, ठीक है. देन वी हैव फीमोरल रीजन, फीमोरल रीजन में जैसे कि रेक्टस फीमोरस, रेक्टस फीमोरस, ठीक है. देन टॉकिंग अबाउट दी नंबर 2 हो गया हमारा, देन नंबर 3. नंबर 3 इज द शेप ऑफ द मसल. शेप में आ जाते हैं नंबर 1 ट्रायंगुलर, एग्जाम्पल डेल्टॉइड. ठीक है, अभी हमने फोटो में देखा था, 3D में भी देखा था. देन वी हैव क्वाड्रेंगुलर, ठीक है, क्वाड्रेंगुलर इज क्वाड्रेटस फेमोरिस, quadratus femoris. Then we have the rhomboid. Rhomboid is diamond shaped, and this is rhomboid major. Sorry, rhomboid major. Okay, then we have trapezoid. ठीक है, trapezoid for trapezius. Okay, then we have serrated. Serrated for serratus anterior. Serrated serratus serrated serratus anterior, I'm sorry, serratus anterior, serratus anterior. ठीक है. Then we have straight. Straight के लिए वर्ड यूज होता है rectus, and you can guess the name of the muscle, rectus, rectus abdominis. ठीक है. Then you have slender, पतली सी मसल है, that is gracilis. We will read about each of these muscles in 3. ठीक है, टाइम आने पे रीजन वाइज, सो डोंट वरी. एक एक को भी दिखाने बैठूंगा तो फिर द क्लास विल नॉट फिनिश. सो राउंड और टीरिस, दैट इज द टीरिस मेजर. ठीक है, सो दिस इज द शेप. देन बेस्ड ऑन द एक्शंस, नंबर 3 हो गया, नंबर 1 हो गया था, 2 हो गया. ओके, देन 3 शेप हो गया, देन 4 इज बेस्ड ऑन द एक्शंस. ठीक है, शेप हो गया था, लोकेशन, रीजन. ओके, एक्शंस में, सो एक्शंस में नंबर 1 इज द फ्लेक्सर. फ्लेक्सर इज द फ्लेक्सर कार्पाई अल्नारिस. ठीक है. देन एक्सटेंसर, इसी के नाम पे मतलब एक्शन जो है दैट इज इजी टू रिमेंबर, एक्सटेंसर डिजिटोरम. देन एडक्टर, एडक्टर दैट इज एडक्टर लॉन्गस. ठीक है. देन एबडक्टर, आई होप यू नो दीज एक्शंस, हमने पहली क्लास में डिस्कस कर लिए थे. एबडक्टर पॉलिसिस लॉन्गस. एग्जाम में पूरे पूरे नाम लिखने हैं, अभी जस्ट टू सेव टाइम आई एम राइटिंग इन शॉर्ट. देन सुपिनेशन, दैट इज अ सुपिनेटर मसल, इसके नाम पे ही है. ठीक है. देन वी हैव प्रोनेशन एक्शन. प्रोनेशन इज प्रोनेटर टीरिस, प्रोनेटर टीरिस. Then we have elevation. Elevation is by levator scapulae. Levator scapulae. Then we have depression. जैसे कि डिप्रेसर, डिप्रेसर एंगुलाई ऑरिस फेस की मसल है. ठीक है. देन डायलेटर, डायलेटर प्यूपिली आईज में मसल है, इंट्रिंसिक मसल, डायलेटर प्यूपिले. देन कंस्ट्रिक्टर, कंस्ट्रिक्टर में कंस्ट्रिक्टर प्यूपिली, अगेन आई की इंट्रिंसिक मसल, कंस्ट्रिक्टर प्यूपिले, ठीक है, ये हो गए एक्शंस. देन वी टॉक अबाउट द नंबर ऑफ हेड्स. ओके, ठीक है, नंबर 4 हो गया था. नंबर 5 इज द नंबर ऑफ हेड्स और पार्ट्स. नंबर ऑफ हेड्स और आई कैन से नंबर ऑफ पार्ट्स. ठीक है. नाउ व्हाट डज दिस हैव? दैट इज नंबर 2. 2 इज बाइसेप्स ब्रेकिया है. 2 हेड्स है मसल के, हमने देखा भी था 3D में. बाइसेप्स ब्रेकिया है. 3 हेड दैट इज ट्राइसेप्स ब्रेकिया है. क्लासिकल एग्जांपल्स हैं, बड़ी इंपॉर्टेंट मसल्स हैं ये सारी. ठीक है. देन यू हैव 4 हेड्स दैट इज क्वाड्रिसेप्स फीमोरिस, हमारी लोअर लिम्ब की मसल है. ठीक है. देन वी हैव 2 पार्ट्स और आई कैन से 2 बेली या डबल बेली मसल दैट इज द डाइगैस्ट्रिक मसल. ठीक है. देन बेस्ड ऑन द अटैचमेंट्स, नंबर 6, based on the attachments sternocleidomastoid attached to sternum, clavicle and mastoid process. Then styloid process and the hyoid bone. ठीक है. देन वी हैव 6 हो गया. नंबर 7 वी हैव द डायरेक्शन ऑफ फाइबर्स. ठीक है. सो डायरेक्शन ऑफ फाइबर्स में स्ट्रेट मसल फाइबर्स हो सकते हैं, स्ट्रेट. ठीक है. स्ट्रेट एग्जाम्पल रेक्टस एब्डोमिनस, स्ट्रेट में रेक्टस एब्डोमिनस. देन ट्रांसवर्स में ट्रांसवर्स एब्डोमिनस. देन ओब्लीक में वी हैव एक्सटर्नल ओब्लीक. ये भी एब्डोमेन की मसल है. ठीक है. देन टॉकिंग अबाउट द साइज ऑफ द मसल्स. ठीक है. साइज 8th इज साइज. अब साइज के बेसिस पे नंबर 1 इज द बिग साइज दैट इज पेक्टोरालिस मेजर. एक एग्जाम्पल हम याद कर रहे हैं ताकि वी रिमेंबर. पेक्टोरालिस मेजर. ठीक है. स्मॉल पेक्टोरालिस माइनर. ठीक है. देन लॉन्ग दैट इज एडक्टर लॉन्गस. ठीक है. देन शॉर्ट, दिस इज एडक्टर ब्रेविस. ठीक है. देन ब्रॉड that is latissimus dorsi. ठीक है. then we have depth. then we have the depth. okay, 8 हो गया था. 9 that is डेप्थ. अब डेप्थ के बेसिस पे अगर हम डिवाइड कर रहे हैं दैट इज सुपरफिशियल. वर्ड यूज होगा सुपरफिशियल. दैट इज फॉर द फ्लेक्सर डिजिटोरम सुपरफिशियालिस. डीप वर्ड यूज होता है प्रोफंडा इज ऑलवेज मीनिंग डीप. ठीक है. सो फ्लेक्सर डिजिटोरम प्रोफंडस बड़ी इंपॉर्टेंट मसल्स है, पढ़ेंगे बाद में. देन एक्सटर्नल एंड इंटरनल वर्ड यूज होगा। एक्सटर्नल ऑब्लिक एब्डोमिनस, जैसे वही मसल थी अभी मैंने पढ़ी थी अभी, एक्सटर्नल ऑब्लिक, ऐसे ही हो जाएगी हमारी इंटरनल ऑब्लिक, एब्डोमिन की मसल है, ठीक है, एब्डोमिनस लिख दो, एब्डोमिनस, एक्सटर्नल ऑब्लिक, इंटरनल ऑब्लिक, एब्डोमिन की मसल्स हैं। ओके, so these are the classical things which you can remember for them, okay, because there are tons and tons of other muscles which we can keep on writing, but these are the most important ones which you can remember for your exams, ठीक है। Then we come on to the blood supply. So the blood supply of muscles, okay, so the blood supply, the muscles are actually highly vascular, okay, they are highly vascular to fulfill the need for metabolic activity, okay, and muscles, they receive neurovascular bundles through the neurovascular hiatus. So there is a hiatus like an opening. I can show you a very famous common opening. I remove this muscle, this one also, and this one also. This is the thigh region, okay, we are looking at thigh region. So this is a hiatus, very famous and common important one. So you can see vessels, okay, nerves also. So we are adding this neurovascular bundle which is passing through this hiatus, that is the adductor hiatus in the case of adductor magnus. You can see in, if I isolate, this is like a opening in the muscle, okay, so this is the hiatus. So muscles, they receive the neurovascular bundles through the neurovascular hiatus. The blood vessels, they enter the substance of the muscle and they further ramify, okay, and they supply the muscles different through delicate capillaries, okay. So and each muscle fiber, it is accompanied by the set of parallel capillaries, okay. So regarding the blood supply of muscles, there is something very interesting that is known as vascular pedicle, okay, which you should be knowing. Vascular pedicle. So what is this vascular pedicle? A muscle is a segment, a vascular pedicle is a segment of the muscle which is supplied by a single artery and vein. It is segment of a muscle, okay, which is supplied by a one single artery and vein, okay. So that is the vascular pedicle. So based on the number of vascular pedicles, the muscles can further be classified into certain types, okay. So what are these types? Let us see. Based on the number of vascular pedicles, okay. So number one, let us write number one, that is type 1 muscle, that means single vascular pedicle, okay, one vascular pedicle, इसके निमोनिक यूज कर रहे हैं VP, ठीक है, सॉरी शॉर्ट फॉर्म। एग्जाम्पल फेशिया, टेंसर फेशिया लाटा, ठीक है। नंबर 2 the type 2 muscle, it has a single dominant and several minute vascular pedicles, okay. So there is one dominant and several minute vascular pedicles, ठीक है। क्लासिकल एग्जाम्पल gracilis muscle. Number 3, that is type 3 muscles, इसमें क्या है? There are two dominant vascular pedicles from two different source of arteries, from two different source arteries. ठीक है, so for example gluteus maximus, ठीक है, the gluteal region, buttocks वाली मसल, सबसे बड़ी वाली मसल. Then we have type 4 muscles. Type 4 muscles which has multiple vascular pedicles. मुझे पता है इसी की वेट कर रहे थे, मल्टीपल आ जाए तो लास्ट होगा, ऐसा नहीं है, एक और है टाइप 5 भी है. ठीक है, सो एग्जाम्पल दैट इज अ sartorius and the tibialis anterior. Tibialis anterior. Number 5, and this is the last type. Type 5 muscles. अब इसमें क्या बचा होगा? So there is one dominant and multiple secondary pedicles. Multiple secondary vascular pedicles. ठीक है, so for example latissimus dorsi. ठीक है, so this is regarding the vascular pedicles. Now talking about the clinical integration. ठीक है, क्लिनिकल इंटीग्रेशन. Number 1 point, that is the muscle stiffness. Number 2, that is the muscle graft. So muscle stiffness, the severe exercise, it can result in accumulation of lactic acid in the muscle, and that can lead to muscle stiffness. Okay, and this lactic acid is removed by venous blood supply slowly, and the muscle stiffness, it can get resolved. The muscle graft, on the other hand, this is an important part of reconstructive and plastic surgery. It is prepared as a part of muscle with its neurovascular bundle. Okay, so that is the muscle graft. Okay, so next we come on to the nerve supply of the skeletal muscle. The muscle fibers, they are supplied by alpha efferent fibers arising from the multipolar anterior horn neurons of the spinal cord, and they are actually myelinated large diameter fibers. Okay, as you can see in this photo, there is a term known as the motor unit. Okay, so motor unit, it consists of an anterior horn neuron and all the muscle fibers which are supplied by it. Okay, so it consists of one anterior horn neuron plus all the muscle fibers supplied by it. ठीक है, so small motor units, they are present in the precision acting muscles such as the muscles of the eyeball, whereas large motor units, they are present in the postural muscles. Okay, so then there is a concept of the motor end plate. Motor end plate, so it is a junction between the muscle fiber muscle fiber and the axon, and the nerve terminal. ठीक है, So muscle spindles, they are the sensory organs which are located in the muscle only, and they are supplied by the myelinated gamma efferent fibers which arise from the gamma motor neurons of the anterior horn of the spinal cord. So talking about this neuromuscular junction or the motor end plate, the junctional complex of the axon terminal and the muscle fiber. Okay, so this is the motor end plate, or I can say the neuromuscular junction. ठीक है, so at the terminal end, the axon loses its myelination, as you can see here, okay, and divides into terminal branches, okay, and each terminal branch expands at its end. That end is known as terminal button. Okay, this is the terminal button, okay, and forms a junctional zone of muscle fiber at the solo plate, that is the part of the sarcolemma only. Okay, and then if you talk about the terminal button, so this terminal button actually consists of the secretory vesicles. Okay, so you can see this in the another image, secretory vesicles in the terminal button. They are containing the acetylcholine, that is a neurotransmitter, and the numerous mitochondria. Okay, numerous mitochondria, right? So the solo plate or the motor end plate, that is consisting of a number of foldings, as you can see, number of foldings, okay, that contain many receptors for the acetylcholine. Okay, and then there is a synaptic cleft, as you can see in this image again, synaptic cleft. So now this is a narrow gap between the axon terminal button and the motor end plate. This neurotransmitter needs to cross the synaptic cleft, as you can see in this image. ठीक है, acetylcholine को टापना है इसको to go inside. ठीक है, so acetylcholine esterase ACHE is the enzyme that destroys the acetylcholine very quickly. Okay, so further details you will get to understand better in physiology. Okay, because that is more of a, I can say, a topic for physiology. So further details in physiology. ठीक है, अभी anatomically I have just told you what all parts are there, what all structure is there. Now function wise you have to read in detail from Guyton and Gnong. Okay, Guyton is much better, you can make notes from that. Okay, then you have the topic clinical integration, that is the myasthenia gravis. ठीक है, so this is the thing which is, you know, directly related clinically to this topic. So what is this? This is an autoimmune disease. It is an autoimmune disease in which antibodies are found against the acetylcholine receptors. Antibodies are found against the acetylcholine receptors. ठीक है, so these antibodies are progressively, they damage the acetylcholine receptors and the muscles slowly they become weak. Muscles slowly become weak. ठीक है, so that means they are non-responsive to acetylcholine. Sorry, they are non-responsive to acetylcholine. ठीक है, so just remember this terminology is very important. The myasthenia means weakness. ठीक है, myasthenia का literal meaning है myasthenia means weakness of the muscles, and gravis, gravis का क्या मतलब है? serious. ठीक है, so this is something which you should be understanding the nomenclature. Okay. Then you have something known as neurotoxins. ठीक है. So many snake venoms they contain the neurotoxins. ठीक है. This neurotoxin from the snake venom, this binds with the acetylcholine receptors. Okay, and this causes the paralysis of respiratory muscles. So you can imagine such a situation, such a dreaded situation, and this can lead to death. So that is why सांप से सब लोग बचते रहते हैं. ठीक है. So not all snakes are poisonous. There are non-poisonous snakes also that you will read more in detail in the forensic. ठीक है. So next we come on to this concept of muscle spindle, जिसमें we have some fibers. ठीक है. So the muscle, that is the neuromuscular bundle, it's a spindle shaped sensory end organ of the skeletal muscle. Okay, so just write the muscle spindle. ठीक है. muscle spindle, this is a neuromuscular spindle जिसे कहते हैं. ठीक है. so this is a spindle shaped sensory end organ of skeletal muscles. ठीक है. so this contains the, you can say, extrafusal. ठीक है. so there is a concept of this which you will again read in more in detail in the physiology only. I am highlighting these two words, intrafusal and extrafusal fibers वाला concept है. ठीक है. so the extrafusal, which are the main muscle fibers, they are supplied by the extrafusal fibers, they are supplied by the alpha motor neurons. ठीक है. so you can write this, it is an important concept. the extrafusal fibers, the main one, supplied by alpha neuron. Okay, alpha motor neurons. ठीक है. the muscle spindle is supplied by gamma motor neurons. Okay, the sensation is carried by type 1a fibers from the central area of the nuclear chain and nuclear back fibers. Okay, so इसमें ये भी कुछ classical चीज़ें हैं which you will read more in detail. nuclear chain fibers, nuclear back fibers. ठीक है. gamma nerve fiber, alpha neuron, motor neurons. ठीक है. then you have type 1a nerve fiber, type 2 nerve fiber, which are the sensory nerve fibers. ठीक है. so these are some classical things which you will read more in detail in the physiology. Okay, the extrafusal which I am focusing upon, they are the one which are forming the main bulk of the muscle. ठीक है. so they are the one which is the muscle spindle which has intrafusal muscle fibers, they are enclosed within the capsule. Okay, so this there are two types of intrafusal fibers. Okay, which you can write again, two types of intrafusal fibers. Okay, what are these? number one, that is a nuclear back fibers, and number two, the nuclear chain fibers. ठीक है. so many nuclei are located in the middle of the fiber. Okay, in case of nuclear bag fiber. ठीक है. many nuclei you can see are located in the middle of the fiber. nuclear chain fibers का situation क्या है? the nuclei are arranged in the single row and they're long, extending outside the capsule up to the endomysium of the adjacent extrafusal fibers. ठीक है, so you can see this, ये सब इंट्राफ्यूजल है, ठीक है, दिस इज एक्स्ट्राफ्यूजल फाइबर्स, ओके, जो बाहर है, एंड इंट्राफ्यूजल आर इनसाइड, ओके. सो द मसल स्पिंडल हैज इंट्राफ्यूजल मसल फाइबर्स व्हिच आर enclosed within the capsule. Extrafusal are the one which are forming the main bulk of the muscle, ठीक है. So the nerve supply of the muscle spindle is supplied by the gamma nerve fiber, which you can see in this GABA motor neurons, and the sensation is carried by the sensory afferent nerve fibers, that is a type 1A and type 2, ठीक है. The extrafusal, the main fibers, they are supplied by alpha motor neurons. This is the one which is important. You can see in this photo also, extrafusal वाले के ऊपर you can see this nerve is shown, that is a alpha motor neuron, ठीक है. So there's something to remember, and the functions of this during the muscle contraction, the stretching of the muscle spindle, it stimulates the sensory nerve fibers, and these sensory fibers, they are the one which provide input to the CNS about this muscle stretch, and they help to modulate the activity of the motor neurons supplying the same muscle, okay. Similarly, then we have another concept, that is clinical integration also, that is the stretch reflex, okay. इस पे कभी कभी शॉर्ट नोट आ जाता है, अगेन फिजियोलॉजी में पढ़ोगे. Stretch reflex, I am telling very briefly because this is given in your textbooks in anatomy also, so just you should know a brief about it. बाकी details तो गाइडन में पूरा ग्रंथ पढ़ोगे अच्छे से. Stretch reflex, it's a myotactic reflex, okay. It's a myotactic reflex. It can be elicited by, you can see in this photo, एक हैमर ले लिया, उस पे यहाँ पर टेंडन पे हिट किया. सो नॉर्मली क्या हो रहा है, देयर शुड बी अ प्लांटर फ्लेक्शन विथ थ्रू विच वी आर टेस्टिंग द S1 S2 स्पाइनल सेगमेंट, ठीक है. सो इट कैन बी elicited by the blow on the muscle tendon, calcaneal tendon, tendo equilis, which is the strongest tendon of the body. This would induce a muscle contraction, just जो plantar flexion कराएगा, ठीक है. So blow using the hammer on the tendon of the muscle, it causes stretching of the muscle spindle through the sensory input, and this stimulates the alpha motor neurons and finally produces the muscle contraction, okay. इसका example there can be other reflexes like the biceps reflex, ठीक है, यहाँ पर भी biceps reflex भी check करते हैं. So these are actually most important reflexes for maintaining the health of the muscle, ठीक है. So you can see this pathway also, you will study more in detail in the physiology, ठीक है. Then we have something for the lubricating mechanism of the tendon. So number one, we have the synovial bursa. Synovial bursa. So it's a closed sac of membrane which contains a thin film of slippery fluid, okay. So bursa का literal meaning, that is purse in Latin, ठीक है. bursa is purse in Latin. So it's a lubricating device that helps to diminish the friction and it allows the free movement of the muscle tendons. As you can see, ये अब हम knee joint में डिटेल में पढ़ेंगे obviously. एक lateral view है knee joint का, जिसमें you can see patella, femur, tibia bone. इसके ऊपर, आगे, पीछे, नीचे there are some bursas, ठीक है, for the lubricating mechanism of the tendons. So you can see patella के ऊपर है तो it is suprapatellar, patella के पहले है आगे, that is prepatellar, patella के deep में है, that is the नीचे है, नीचे और deep में, that is the infrapatellar. अब दो हैं, there is subcutaneous जो superficially located है, and then we have a deep infrapatellar bursa, ठीक है. So depending upon कि क्या movement हो रहा है कैसे, so these bursas can get involved. So occasionally they communicate with the joint cavity like the one which you can see, the suprapatellar bursa, ठीक है. Then similarly we have in the shoulder joint also we have the subdeltoid or the subacromial bursa, which is actually the largest synovial bursa in the body, ठीक है. So these are the present where the tendons, they are rubbing against the bone, cartilage, ligament or other tendons. Hence they are very common in the limbs, okay, the bursas, which we will discuss eventually joint by joint. They are also found close to the joints where the skin rubs against the underlying bony structures. For example, the pre-patellar bursa. So you can imagine the skin is rubbing against this bone. So we need a bursa here also. So there can be types of bursae, which is like the subtendinous bursa, articular bursa. Okay, so you can write, we have the types of bursae. Okay, like we have the subtendinous bursa, we have the articular bursa, and number 3 we have the subcutaneous bursae. ठीक है, types of bursae. All right, so subtendinous, these are present between the tendon and the bone, tendon and the ligament, or between two adjacent tendons. The most of the synovial bursae of the limbs, they are belong to this type only. Okay, then you have the articular bursa, which are present, articular means joints, so they are present close to the joint. For example, the bursa between the dens of the axis, you have atlas axis, the first and second cervical vertebra, if you remember. So the bursa between the dense part of the axis, that is the second cervical vertebra, and the transverse ligament of atlas, that is the first. So there is a chance of friction. So there you have a bursa, that is the articular bursa, that is the joints of head and neck, we will understand. Subcutaneous bursa, that is present between the skin and the bony prominence near the joints. For example, pre-patellar bursa. Pre-patellar bursa, it can get involved and inflamed, so that will lead to the housemaid's bursa. ठीक है, कंडीशंस पढ़ेंगे हम बाद में डिटेल में. ये कुछ बर्साइटिस होते हैं. हाउसमेड्स बर्सा. ठीक है, दिस इज प्री-पेटलर. ठीक है, देन यू हैव सबक्यूटेनियस, that is clergyman's. Clergyman's bursa, that is subcutaneous one, subcutaneous infrapatellar. ठीक है, इसको डिटेल में हम पढ़ेंगे, डोंट वरी, नी जॉइंट वाले चैप्टर में आएगा ये विद फोटोज. ठीक है, सो जस्ट टेलिंग यू इन ब्रीफ हियर. Then we have lubricating mechanisms of the tendons. First was the bursa only. The second one is the synovial sheaths. Synovial sheaths. So it's a tubular synovial coating over the tendons, and it is a modified bursa only. It prevents friction of the tendon while passing through the tunnel. Okay. Then talking about the clinical integration, as you can imagine, clinical integration would be easy to understand. That is the bursitis only. ठीक है, clinical integration, bursitis, inflammation of the bursa, so it can lead to swelling and pain. ठीक है, inflammation of the bursa, inflammation of the bursa, and this can lead to swelling and pain. Hence the patient will come to you with this problem. Then we come on to the actions of the muscles. Okay, now actions of the muscles, ये चैप्टर थोड़ा सा लेंदी है, but it is very important. It has a lot of important headings, sub headings, which are asked in the exams. ठीक है, so actions of the muscles. So on stimulation, the muscle contracts and produces movements. We all know this range of movement depends upon, number 1, the length of the fleshy fibers. Length of the fleshy fibers. Number 2, okay, so the range of the movement, we're talking about the range of movement depends upon, ठीक है, length of fleshy fibers, the number of fibers. Number 3, the power or force of contraction. Power or force of contraction. ठीक है. So number one, that is the muscle tone. Okay. We have the muscle tone. This though you might have heard somewhere. So that is the amount of tension or contraction in a muscle at rest. Amount of contraction or tension, very important, at rest. ठीक है. So function क्या हुआ? It will help to maintain the body posture. It will help to keep the body straight during sitting and standing. It is maintained by a set of motor units, that is the muscle fibers. Okay. So all motor units, they are not contracting simultaneously at a given time. Only some of these motor units, they contract to maintain the muscle tone constantly. Okay. So we have two kind of tones in this, you might be knowing. One is the hypertonia and the second one is the hypotonia. ठीक है. Hyper means hypertonia is increased muscle tone and hypo means decreased muscle tone. ठीक है. Now what are the factors which can affect the muscle tone? Factors affecting the muscle tone, they are the neurological conditions. So there can be certain disorders which you will read in the medicine. The neurological disorders which can lead to tonicity problems. Then exercise improves the tone of the muscles, you know. Then age with age the tone decreases. The physical therapy can improve the tone of the muscles. ठीक है. Then we have the this was the muscle tone. ठीक है, ये था हमारा muscle tone. Then we come on to this actions of the muscle, that is the tension and length relationship. Okay, so the tension and length relationship. ठीक है. So the muscle excursion, what is muscle excursion? This means displacement of the myotendinous junction. Myotendinous junction throughout the range of motion. ठीक है, मतलब कि what is happening, the myotendinous junction, okay, मसल और टेंडन का जो जंक्शन है, that is actually getting displaced throughout the range of the motion. Okay, so that is the excursion, मतलब कि कुछ तो movement हो रहा है. So tension is the force which is built up within the muscle during the muscle contraction. ठीक है. And the stretch, actually this builds the tension. Okay, so you can write, these are two very important terminologies, clinically and relevant also. The tension is the force which is built up within the muscle, okay, during the muscle contraction. Okay, compare it to the stretching. Now stretching is the building of tension within the muscle during muscle contraction. Okay, so it is, stretching is building up of tension, okay, within the muscle during the muscle contraction. So you can see in this photo also, the muscle, it shortens by 1/2 to 1/3 of its normal resting length ड्यूरिंग मसल कॉन्ट्रैक्शन। सी कॉन्ट्रैक्शन पहले लेंथ नॉर्मल लेंथ थी रेस्टिंग पे, फिर कॉन्ट्रैक्ट हो गई तो इसकी लेंथ जो है विच गेट डिक्रीज्ड, ओके, अब ऑलमोस्ट बाय 1/2 और 1/3। द एक्शन ऑफ द मसल इज स्ट्रॉन्गेस्ट व्हेन इट इज स्लाइटली स्ट्रेच्ड, ठीक है। सो अगर स्ट्रेच कर देंगे दैट इज द टाइम, ओके। सो ये जो डिस्प्लेसमेंट हुआ दिस इज नोन एज एक्सकर्जन, ओके। So classically we have we have the types of muscle contraction. Classically we have the types of muscle contraction. So muscle contractions can be of 4 types primarily. One is the isometric contraction, okay, that means the length of the muscle does not change. फिर नाम लिख लेते हैं isometric. Then we have isotonic. Number 3 we have concentric. And number 4 we have eccentric contraction. Just wait. We have isometric contraction, we have concentric contraction and eccentric contraction, ठीक है। So now let us see the differences. एग्जाम में पूछे जाते हैं, so it is important. First case scenario, the length of the muscle does not change. Length of the muscle does not change. Tension does not increase. Hence the tension does not increase, ठीक है। So example, holding the hand in the outstretched position, okay, that is isometric. Holding hand in outstretched position. Isotonic, the length of the muscle changes. Length of the muscle changes, the tension is constant. Tension does not change. For example, movement of fingers and hands. ठीक है। Then we have the concentric contraction. अब इसमें क्या हो रहा है, लेंथ the length of the muscle it decreases, ठीक है। tension is increased, ठीक है। So most of the movements are produced by concentric contraction only. Most of the movements, ठीक है। Last is the eccentric. So length of the muscle, now you know the length and tension जो हमने पहले डिस्कस किया, so that is why I have discussed पहले. The length of the muscle it decreases, but the desired tension is maintained, ठीक है। So it is constant, tension maintained. For example, lowering the arm to the side of the body. Lowering arm to the साइड ऑफ बॉडी. सो लेंथ जो है वो कम हो जाएगी और टेंशन जो है वो मेंटेन रहेगी, ओके, ड्यूरिंग दिस मूवमेंट. एंड मोस्ट ऑफ द मूवमेंट्स में जिसमें लेंथ डिक्रीज हो रही है बट टेंशन इंक्रीज हो रही है, दैट इज मोस्ट ऑफ द मूवमेंट्स. ठीक है. आइसोटोनिक में क्या हो रहा है कि लेंथ इज गेटिंग इंक्रीज बट द टेंशन इज नॉट इंक्रीजिंग, ओके. दैट इज द मूवमेंट्स ऑफ हैंड्स एंड फिंगर्स. ठीक है. Then you have the length is not decreased, tension is also tension is not remaining constant but it is increasing. Sorry, the length of the muscle, it does not change but and the tension does not increase, okay. So that example is a holding the hand in the outstretched position. Okay. So tension also does not increase, so you can just write this cross. Okay. It is easy. So this is types of muscle contraction. Then we come on to this important concept, it is Viva question. Number 1, that is the prime mover or agonist, then antagonist, then synergist, and we also have a fourth category, that is category number 4. Fourth category, that is the the prime movers or the agonists, then we have the antagonist or the opponents, and then we have the synergist, we have the fixators or the stabilizers. ठीक है. So this is first, second is antagonist, थर्ड इज सिनर्जिस्ट एंड फोर्थ इज फिक्सेटर और स्टेबलाइजर. इसको समझने की कोशिश करते हैं, बड़ा इजी है ये. ठीक है. सो प्राइम मूवर एग्जांपल हम क्या ले रहे हैं, फ्लेक्शन एट द एल्बो, दैट इज द क्लासिकल एग्जांपल विच वी आर यूजिंग टू रिमेंबर. ठीक है. अब इसमें देखेंगे हम क्या क्या चीज़ें आई. सो दीज आर द ग्रुप ऑफ प्राइम मूवर्स. द एगोनिस्ट वन, दीज आर द ग्रुप ऑफ मसल्स विच आर प्राइमरली रिस्पॉन्सिबल फॉर प्रोड्यूसिंग अ स्पेसिफिक मूवमेंट एट द जॉइंट. So they are the chief movers or prime muscles. So example elbow flexion. Elbow flexion में जो मेन मसल है हमारी बाइसेप्स ब्रेकिया, दैट इज अ प्राइम मूवर फॉर फ्लेक्शन एट द एल्बो जॉइंट. सबसे आसान. अब इसको ऑपोजिट एक्शन, द मसल विच अपोज द एक्शन ऑफ द प्राइम मूवर, दे अंडरगो कंट्रोल्ड रिलैक्सेशन ड्यूरिंग द कंट्रैक्शन ऑफ प्राइम मूवर्स. दीज आर द एंटागोनिस्ट. इसके केस में ट्राइसेप्स, जो पीछे वाली मसल है, ट्राइसेप्स ब्रेकिया. ठीक है. दिस इज रिवर्स इन रोल इन द एक्सटेंशन ऑफ द एल्बो जॉइंट. ठीक है. देन वी हैव फिक्सेटर्स और स्टेबिलाइजर्स. दे कॉन्ट्रैक्ट टू स्टेबिलाइज द ओरिजिन ऑफ द प्राइम मूवर. प्राइम मूवर कौन था, बाइसेप्स ब्रेकिया. इसका ओरिजिन यहाँ पर था शोल्डर पे. सो इसको स्टेबिलाइज और फिक्स करने के लिए हेल्प कर रहा है. सो मसल्स अराउंड द शोल्डर जॉइंट, दैट इज स्टेबिलाइजिंग द स्कैपुला to so that the biceps it can contract and produce the elbow flexion effectively. ठीक है. So easy है, that is the fixator or the stabilizer. Then last but not the least we have the synergistic. They assist the prime mover in executing the movement. वो ज़रूरी नहीं है कि they perform the same action as prime mover but they are assisting action. ठीक है. synergist है. So if a muscle crosses more than one joint, the synergist they prevent the undesired action at the proximal joints. ठीक है. फॉर एग्जाम्पल इस वाले पूरे केस में ब्रेकियोरेडियालिस एक मसल है विच यू विल गेट टू नो इवेंचुअली. दिस एक्ट्स एज अ सिनर्जिस्ट टू द बाइसेप्स ब्रेकिया टू प्रोड्यूस फ्लेक्शन एट दिस एल्बो जॉइंट. ठीक है. सो दिस इज वन एग्जाम्पल विच यू कैन रिमेंबर. ठीक है. सो हमने सारी मसल्स तो यहाँ पर लिखी हुई हैं, फिक्सेटर्स और स्टेबिलाइजर नहीं लिखा है. सो दैट इज द मसल्स अराउंड the shoulder, stabilize scapula. ठीक है. Then we have a new concept, another concept, that is the shunt and spurt muscle. ठीक है. अब इसमें क्या क्या कंसेप्ट आ गया हमारा. शंट एंड स्पर्ट मसल में सिंपल है, इट्स अगेन अ वेरी इजी थिंग. द स्पर्ट एक याद रख लो, दूसरा याद रह जाएगा. सो स्पर्ट मसल इज द वन विच इज द ओरिजिन. ओके. शंट, सॉरी पहले शंट देख लेते हैं. शंट मसल इज द वन, एग्जाम्पल ब्रेकियोरेडियालिस. द इंसर्शन इज अवे फ्रॉम द जॉइंट. सो ये मसल है, ठीक है, इसका प्रॉक्सिमल अटैचमेंट ओरिजिन होगा, डिस्टल अटैचमेंट इंसर्शन होगा. सो इंसर्शन जो है दैट इज़ क्वाइट फार अवे फ्रॉम द जॉइंट, जॉइंट एल्बो जॉइंट पे मूवमेंट हो रहा है, ठीक है. कंपेयर टू दिस टू द स्पर्ट मसल, जो ब्रेकियालिस मसल है कि यहाँ पर बाइसेप्स ब्रेकिया के अलावा वी हैव अ ब्रेकियालिस मसल ऑल्सो. दिस इज हेल्पिंग इन दिस एल्बो फ्लेक्शन, बट दिस इज इंसर्शन, ये जो इसका इंसर्शन पॉइंट है दिस इज वेरी क्लोज टू दिस एल्बो जॉइंट. सो दिस इज अ स्पर्ट मसल, ठीक है. सो दिस इज द जॉइंट कौन सा है टू विच दीज मसल्स आर एक्टिंग. ओके, सो क्लासिकली एक याद रख लोगे, दूसरा याद रह जाएगा. तो इट इज़ ईजी टू रिमेंबर द शंट वाला मसल, ठीक है. शंट वाला इज अवे फ्रॉम द जॉइंट, ठीक है. सो दूसरा वाला ऑटोमेटिकली नियर टू द जॉइंट हो जाएगा, ठीक है. सो एग्जाम्पल भी क्लासिकल दे दिया, ब्रेकियोडियालिस और ब्रेकियालिस. ओके, देन वी कम ऑन टू द लास्ट पार्ट ऑफ टुडेज क्लास, दैट इज द क्लिनिकल इंटीग्रेशन ऑफ वट एवर वी हैव डिस्कस्ड. Clinical integration. Number 1, that is the poliomyelitis. Poliomyelitis is an infection by the poliovirus. The virus enters the body through the oral route, which later enters the nervous tissue and affects the motor neurons of the spinal cord. This can cause permanent lower motor neuron paralysis or the muscle weakness. Okay. Secondly, we have the word that is paralysis itself. So this means loss of voluntary muscle function. It can be due to damage to the brain, spinal cord or peripheral nerves. Okay. Number 3, we have upper motor neuron paralysis. Okay. So that is involving the loss of control of the cerebral cortex over the anterior horn cells of the spinal cord. So this results in spastic paralysis, exaggerated tendon reflexes. You will study about this in detail in physiology, okay, and this will keep on coming again and again also. In neuro we will discuss in detail obviously. The element that is the lower motor neuron paralysis. It involves the damage to the anterior horn cells of spinal cord itself or the peripheral nerve which supplies the muscle. This can result in flaccid paralysis with the loss of tendon reflexes. Okay. Then we have number 5, that is the muscle spasm, which is very common entity. Muscle spasm or pulled muscle, painful contraction of the muscle. It can occur in tetanus, epilepsy, high temperature, in fever, excessive exercise, and the list is endless. Then we have the muscle atrophy, a reduction in the fleshy part of the muscle due to the loss of contractile proteins. This can occur in the used muscles for a long time and this is known as disuse atrophy. So हम अगर ब्रेन को नहीं यूज़ करेंगे, जस्ट अ जोक्स अपार्ट, लाइक अगर ब्रेन को बहुत ज़्यादा यूज़ नहीं करेंगे डेली तो डिसयूज एट्रोफी हो जाएगी, हमें कुछ याद नहीं रहेगा, ठीक है, जस्ट किडिंग. ओके, देन वी हैव नंबर 7, दैट इज हाइपरट्रॉफी, ठीक है, दैट इज इंक्रीज इन द, ये लिख लो, इंक्रीज इन size of muscle fibers. ठीक है, it occurs in mechanical stress such as exercise. Then you have hyperplasia. Hyperplasia is increase in the number of smooth muscle cells. ठीक है, so for example hyperplasia of the myometrium of the uterus during pregnancy. Okay, that is a classical example. Number 9 and the last one, that is the muscle injury and healing. Okay, so skeletal muscle, they have limited capacity for regeneration. So if a large portion of the muscle is damaged, it can be replaced by connective tissue during healing. Okay, so then we come on to some interesting facts. You can remember the total number of muscles in the body, that is around 400. The gluteus maximus is the largest muscle of the body. Sartorius is the longest muscle of the body. Stapedius is the smallest muscle. Plantaris muscle has the longest tendon. Achilles tendon or the tendoachilles, these all we will discuss in very detail region wise. Okay, so don't worry if you are not able to understand where they are present, definitely you will hear them from me in region. So Achilles tendon or tendoachilles is the largest tendon in the body. It is also the most commonly ruptured tendon. Then motor unit we have already seen, functional contractile unit of the muscle. Red muscle or slow twitch fibers. Then skeletal muscle has few satellite cells. Okay. In cardiac muscle, the satellite cells are absent. Then we have some vestigial muscles of the body like palmaris brevis in the hand, auricular muscles, auricularis superior, posterior, all these muscles. Then soleus is also known as the peripheral heart of the body as it helps in the venous return. We will study this in detail in the lower limb. Muscles used for intramuscular injections, we have already seen deltoid, gluteus medius and vastus lateralis. Remember gluteus medius, not maximus. Okay. Hybrid muscles, we will read them also in detail, list बनाएंगे अच्छे से, ठीक है, time आने पे. So they are the hybrid muscles, मतलब they are the one muscle is supplied by two nerves, ठीक है. So for example FDP, classical example FDP, जिसमें median nerve और ulnar nerve supply कर रही है. Adductor magnus, पेक्टिनियस, डाइगैस्ट्रिक, ये कुछ क्लासिकल एग्जांपल्स हैं, कुछ लोअर लिम्ब में, कुछ हेड एंड नेक में, वी विल स्टडी देम इन डिटेल, अपर लिम्ब में भी है. देन स्मूथ मसल्स, दे हैव द हाईएस्ट रीजनरेटिव कैपेसिटी. ऑल द मसल्स आर सप्लाइड बाय द नर्व्स फ्रॉम द डीपर एस्पेक्ट एक्सेप्ट sartorius which is supplied by the superficial aspect. We will read that also in detail in the lower limb. So that's it about the muscular system. I hope you have been able to understand this topic well. Please read this, it's a long topic, I truly appreciate. It's a long video also which I could make, but I have tried to complete maximum areas of this chapter. You should not be facing any problem, and if you have, you can ask me queries, but please make it a point to complete this chapter very quickly, because otherwise it will definitely lag behind and you will not be able to understand further. So take care, bye bye.